It's a great honor to welcome the Cuban Medical Brigade to the province of Gauteng, specifically as a Department of Health, which is at the forefront of this response against the pandemic. Indeed, today we meet here in a very difficult context, where the world is facing a battle against an invisible enemy, an enemy that is so tiny that we can't see and even note. This is a virus that has changed how the world will be after the pandemic. Over 5 million people have been infected by this virus. 1.9 million have actually recovered from it. We all know that the disease pattern of this virus, that it is a self-limiting disease, but in a period where it's not being able to be managed, it is very devastating. This is just to acknowledge that we are confronted by this enemy as a global community. This disease has shown itself as one of the most brutal viruses that we have ever faced. As we stand today, millions of people around the world are actually in the space where they are battling with the effects of this virus. The mother, the father, the child, the beloved grandparents are actually affected by this. Usually, when we talk about statistics, we forget that behind these numbers we mention all the time, it's actually somebody's mother, it's somebody's father, it's somebody's son, it's somebody's daughter, and it's somebody's grandparents. The coronavirus has changed the lives of many. I normally say here that if we do the same things that we did before the pandemic, we should know that we are a species that doesn't deserve to survive. Because the virus itself has made it clear that we need to change how we do things and how we function as a country, as the world, and also as a department. It is indeed this honest reflection that the South African commitment to fighting this pandemic and doing its best to protect the lives of South Africans is unparalleled. And we must also remember that the work that we put in South Africa also protects our neighboring countries, Lesotho, Swaziland, Namibia, and Botswana. So the utmost effort that we put in making sure that the spread is slowed down, the spread is well managed, it is also having a direct effect and impact on our neighboring countries. As we know that Cubans are very known as being internationalists, we also, as South African revolutionaries, we believe that our struggle and our fight is also to protect other people in other parts of Africa. On the 21st of May, South Africa had over 19 cases of infected individuals and over 360 deaths. The provincial COVID-19 breakdown in Gauteng showed us that we've got 2,453 cases, and these are cases that we have accumulated from the 7th of March, and we have got 1,776 recoveries with 29 deaths. Out of all these infected individuals, we've got 13,442 contacts that we needed to trace and find, and also begin the process of monitoring them and doing medical surveillance on them. And this is the number of people that we have been able to trace. We've got 8,560 people who have completed their 14-day isolation period and quarantining, and they've reported no symptoms, and some of them have tested negative. We also need to indicate that out of all the number that I've said of 2,000, 453 people. We had only had 70 people that have been hospitalized. So there are a number of things that are quite different with what is happening in Gauteng with the COVID disease. These numbers are very high, but it's important to acknowledge that the spread of the virus over the past few months is as a result of what the South African government intervention have actually been able to control the spread. I'm using this word control the spread deliberately because we are not going to be able to stop the virus spreading. Our methods and our measures that we are going to be put, the work that we'll be going together to do in our community is to manage the spread and manage those who are in actual effect affected. At the beginning of the outbreak, Gauteng was leading in terms of numbers of cases. Now is no longer the case. Our province has still significantly made progress in terms of the numbers of active cases. But this is not something that we should celebrate currently, because this is the nature of this disease that is going to make us believe that exponential growth in a real sense is possible. So it's important that we put in all our efforts in making sure that we regulate and we manage the spread of the disease. Gauteng COVID-19 response is one that has 6 pillars. It's focusing on the public health response. It's focusing on food security and social relief. It's focusing on law enforcement and compliance in terms of regulations of the Disaster Act. It is also based on social mobilization. And the last pillar is an important one, is of the economy and the state adaptability moving forward. We need to make sure that beyond the pandemic, we have a very adaptable state that will be able to provide quality healthcare service moving forward. Our provincial health response has included district-wide mass screening and testing, flu immunization, increasing our bed availability at all our facilities. This also meaning that we are talking to the private sector in making sure that they guarantee and avail beds that will be dedicated for COVID patients. We've also been procuring and making sure and ensuring that all our healthcare workers in different categories, they've got adequate and sufficient personal protective equipment. This is the work that we have been doing in the past 10 weeks, and it's something that we are proud of the work that we have been doing. One thing that we have done now is that we have changed gear, and that's where we're going to use the experience of the Cuban brigade, because now we are moving into our communities doing a door-to-door and a ward-based approach in terms of the strategy, particularly in areas where we have actually recognized them as hotspots. This is also what we think will be a backbone of our national health insurance, because what we are hoping to achieve and build beyond this is to build a primary healthcare system that is going to be able to create a sustainable healthcare system going forward. So we are welcoming you with excitement, because we are ready to learn from you. We've got a number of students who have trained from Cuba, and I'm certain wherever they are excited that they will again meet with some of you and be able to do the work that they are trained to do. Prevention is better than cure, and prevention is much cheaper. So our strategy in terms of our work-based approach is to make sure that we run a particular successful prevention campaign in terms of spreading the word on the hygiene.